15 minutes. Be sure to include your name and license types for your CEUs when you fill out the conference evaluation. You must complete the conference evaluation for your CEU to be processed. You will receive your CEU certificates as soon as possible after the conference at the email address you used to register. We do hope that everyone, regardless of CEUs, will complete the conference evaluation. The conference evaluation link will be posted in the chat box, in the break time slides, and on our website. Please only use the Q&A box to post questions for the speakers related to their presentations. Use the chat box for technical questions and to find the CEU sign in and sign out links and codes. I will follow the Q&A box, combine the questions, and share them with the presenters after the presentation. Personal information can be seen by all, so please consider this when posting in the chat or the Q&A boxes. Okay, here we go. The CEU sign-in code for this session is 11. Again, the sign-in code for this session is 11, and I'm posting it in the chat box now. Okay. Now, I would like to introduce Mary Beth Fisk, CEO of the Ecumenical Center for Counseling, Education, Health, South Texas Trauma Informed Care Consortium Institute lead, and Kathy Fletcher, CEO of Voices for Children, Tri-Chair for the South Texas Trauma Informed Care Consortium Early Childhood Work Group Co-Chair, for this session, which is entitled Trauma Informed Care Training and Certification.
Hello, everyone. This is Mary Beth. I welcome you to this afternoon's session, and I congratulate you on a Saturday afternoon for joining in the conference. We are very pleased and honored to be with you and to offer an update and a little bit of history about the South Texas Trauma Informed Care Consortium's work, which began back in 2018. We'll begin with Dr. Kathy Fletcher, who will present. She is a Tri-Chair, as mentioned before, and has been with this initiative from the very start. So, Ms. Kathy, take it away.
Okay, thank you, Mary Beth and Charlotte Ann, and welcome everyone. This is such an important initiative. There are many similar trauma-informed and resilience initiatives going on around the country. And we are very happy to tell you about the one in Bexar County. So I will be telling you something about the beginnings of the work to address trauma in Bexar County, and that's the South Texas Trauma Informed Care Consortium. Now, why did we do this? Slide, oops, there it is. Why did we do this? Many of us have worked in healthcare, human services, child welfare, and we were well aware of the continuing research and continuing information coming out on the impact, the common frequency of trauma in childhood and the lasting effects into adulthood. Actually, the initial research came out of the healthcare system, and they found that many conditions, many adult conditions and diseases had very strong links to traumatic experiences and toxic stress in childhood. So I will give you a little bit of the history of this and another few numbers about why we're doing this. I couldn't make this into a slide, so I'll just tell you. 98% of female offenders have experienced trauma, often interpersonal trauma and very, very often domestic violence. 96% of adolescent psychiatric patients have a history of exposure to trauma. 93% of homeless mothers have a lifetime history of interpersonal trauma. 90% of juvenile justice involved youth have experienced trauma, often multiple traumas from an early age. 75% of adults in substance abuse treatment report histories of trauma. That's particularly true of female substance abusing people. Very, very strong connection to early trauma, particularly early sexual abuse. 70% of children in foster care, no surprise, have experienced multiple traumas. the American Academy of Pediatrics calls toxic stress and childhood trauma, adverse childhood experiences, the greatest unaddressed need in our time. So it's very, very important. So what you're seeing here is the beginnings of the Trauma Informed Care, South Texas Trauma Informed Care Consortium, which is now part of 1/3 of the effort. The consortium tri-chairs, the three of us who began this effort, are Dr. Colleen Bridger. At the time, she was director of San Antonio Metropolitan Health District, now assistant city manager for the city of San Antonio. Me, I'm president and CEO of Voices for Children of San Antonio, and Yvette Sanchez, who is the COO at the Children's Shelter. How we started, goodness. In May 2018, the Children's Shelter put on an excellent and first trauma conference, which attracted a lot of local people and people from all over the state and beyond. Annette Rodriguez, the CEO of the Children's Shelter, and I had been talking about this. We knew we needed to begin to organize people around an effort to combat trauma, toxic stress, and the long-term impact. So Annette called a meeting at the end of that conference for anyone who was interested in beginning a collaboration, beginning to talk, developing a consortium. At the same time, Dr. Colleen Bridger had fairly recently come to San Antonio to become director of Metro Health. And it turned out that that was a very big priority of hers. So the three of us essentially got together. Slide, please. Okay. Our initial goal, still our goal, is the consortium will work to mitigate the effects of adverse childhood experiences by working together to create a certified trauma-informed Bexar County. We said certified because trauma-informed care have become almost buzzwords. And they're said a lot of the time without enough very good training to back that up. And we didn't want that to happen. We wanted to have a very strong set of standards and training so that all children, all adults would have access to trauma-informed practices. So that was May. Can I have the slide, please? Okay. We called a second meeting and then a third, and during that time, the group grew. We invited other people, and we began working on the structure. So we identified with the group 11 and then 12, higher education being the most recent, but that was quite a while back, where that impacted virtually all children and adults. And we developed those, we identified those work groups, decided that each work group would have chairs, most often co-chairs, occasionally a tri-chair, to make sure that there was a lot of stability. And the task of each of those work groups, because these are the experts in those sectors, the task of each of those community sector work groups was to develop strategies for awareness of toxic stress and trauma and the impact, and then to begin developing strategies to address and change that situation. Together, the chairs of all of the chairs of those work groups form the steering committee of the consortium. Okay. I have to tell you that at this point, it was far more aspiration than was reality. We knew it was something we had to do. We had absolutely terrific community partners, but we felt very much like we were beginning to fly a plane while we were still building it and beginning to build it. All of us, particularly the tri-chairs, but really all of us, then started going all around the community, making presentations on adverse childhood experiences, trauma, and toxic stress, to anybody who would let us present. And we did a lot of that. They were, each of the groups presented with their groups in mind. We did a lot of work with very early childhood care and education, primarily child care. The mental health group presented to mental health organizations, to groups that were concerned with mental health and behavioral health. So we did a lot of that. Slide, please. Okay. Give you just a couple of things that we talked a lot about. Toxic stress is what we're most interested in, and people use trauma and toxic stress interchangeably, and they're really not the same. Trauma is generally an immediate event, and your body reacts to that to help you cope with it. You know, the example that's often given is a bear coming at you. Well, many of us have had the experience of almost having an automobile accident, and all of a sudden you slam your feet on the brakes and all the adrenaline flows, and you have the instant reaction. But then you start settling down, and all of those chemicals start settling down. But if that trauma, especially when you're very young, keeps going on, or is frequent, or is unpredictable, then you don't have a chance. The body doesn't have a chance to recover. And that's what causes a tremendous number of problems immediately and then far into adulthood. Slide, please. Okay, we're going to hit this, but I have to tell you, there is no, and you may probably know from other sessions, that there is no audio. I do want to tell you, though, that this little video comes from the Center for the Developing Child at Harvard University, which you can access to get great videos, information. You can download them. You can use them all over. Okay, can we hit that, or do I need to hit it? You can hit it. This is extremely important. If it just goes, I'll just talk over it. Essentially what it's saying is, at the very earliest time, it's the experiences of the youngest children that basically helps them develop their brain architecture. And if what they experience is good and supportive, then a lot of good things are embedded there. What is happening the first few years is there's a phenomenal amount of brain cells, connections, mostly connections, going on in the baby and young child's brain. If there are good things happening and the body is reacting in a good way, then those things get reinforced. Those connections get reinforced. And things that are not so good fade away because they're not reinforced. That's a process called pruning, and it's very, very important. So to give you an example with a very young child, if that child experiences fearful, scary, non-supportive kinds of things, then the reaction, the fight or flight reaction, fighting is very noticeable, flight is not. They're equally bad. Those things get reinforced. Whereas if the child learns that they can handle a difficult situation or a temporarily difficult situation, that the world is not a scary place, then that gets reinforced. And that's very important. Okay. That's where it comes from. Slide, please. One of the things that I think we see in the youngest children that later on will look like very serious behavioral health issues. The area of the brain that gets very much impacted by toxic stress is the one that controls executive functioning. These are the children who at 2, at 3, at 4, at 7 can't control their impulses, can't follow directions, react in very unhealthy ways in the classroom, in the child care center, in the family. And it doesn't get much better. It has to be addressed. And just those behaviors, I'm sure you all know, bring to the child some other very negative kinds of things, and they cannot learn. So they are behind in school and are not able to make friends as easily. And it just continues to get worse. And by the time we see them in the mental health system, it's a lot harder than if it's addressed in the early years. But these are the little ones who at 2 may be either hiding in a corner and crying, which is flight, or they're throwing the chair across the room and are getting expelled from childcare. So that's what goes on if there is toxic stress during the time of the development of that brain architecture. Okay. Look. Okay, to go on with the history. Let's see. I think you can get rid of that, Mary Beth. Okay, in May, whoops, nope, don't want that yet. But in May 2019, we were only a year old, and we were beginning to feel good, but we knew we were just still flying the plane without it completely built. The City of San Antonio and Bexar County declared May as Trauma-Informed Care Awareness Month. So we were really pleased. The City of San Antonio also included funding for an Institute for Trauma-Informed Care in the city budget. The reason we wanted to develop an institute locally is that organizations, and the Children's Shelter is one, organizations that wanted their entire operation, their entire organization to become truly trauma-informed, had to go for training and assessment over a considerable length of time, back and forth to other places in the country. It was difficult and it was expensive. And what we very much wanted was for Bexar County organizations and Bexar County groups to be able to access the same training, the same assessment, the same support to develop trauma-informed practices, even if they were not financially or logistically able to do that, to contract with someplace in Chicago or Washington, D.C. or wherever. So that's what we wanted. At that time, we were absolutely thrilled. University Health System, well aware of the impact of trauma and toxic stress on the patients they see every day, came in and wanted to be a partner. So they matched the funding with the city and to develop, and they are the lead in the Institute for Trauma-Informed Care. It's been an interesting journey, and we have contact with a number of other efforts like this across the country, and we get a lot of very positive feedback about how quickly we've developed and what we've done so far and how it's moving along. But I have to tell you, we still felt like there was a whole lot of that plane that we were real uncomfortable with, that we just knew we had to do it, so it kept moving ahead. Anyway, once the Institute, or the idea and the funding to develop the Institute for Trauma-Informed Care came about, we also knew we needed another entity or organization to develop standards and to be able to handle the certification process, to know what needed to happen, what the state of the art was, and then to be able to assess where organizations were or groups were, and help lead them towards a certification process at several different levels. And at that point, we, again, not knowing quite what we were doing, we developed an application and a review process. And it was pretty lengthy, and that was the tri-chairs and a number of the chairs of those sector groups did that. And out of that, we chose the Ecumenical Center to be the certifying entity. So we are now essentially three legs on that stool. The consortium, the Institute for Trauma Informed Care, and the certification, the certifying entity. Goodness. Let me just tell you quickly then where the consortium would be as part of this process. Our mission now is we are the why. These are the content experts, essentially. Those 12 sector work groups. The consortium itself, the full consortium, is now somewhere between 500 and 600 people, representing about 300 organizations. So we're just thrilled with that. The mission of the consortium is to provide the content expertise, the resources, and the guidance to the Institute and the certifying entity to inform the development and the implementation of the project. And the consortium tri-chairs will be part of the governance council to uphold the accountability of the certifying process. So Mary Beth will take over after that, but let me just quickly show you this last slide. Slide, please. If you have not already seen it, there's a documentary called Resilience, the Biology of Stress and the Science of Hope. It is an excellent overview. It's so good, so fun, and so informative. If you have not seen it, your group has not seen it, contact any of us or NAMI or WestCare, and we can all put you in touch with whoever has the documentary and set up a screening for your group. This tells you a little bit, and it came from that documentary. This is a program for elementary schools, and it's called Miss Kendra. Miss Kendra is a fictional character who listens to children and tries to support them, lets them know what is not good, that they should not be hit, they should not be hurt. Miss Kendra the children write letters to Miss Kendra, and the results have been wonderful. And then everyone, therapists, counselors, teachers, try to help that child and provide what that child needs to be able to overcome whatever's going on. And what I like about this, even though there are no words, would you hit that, Mary Beth? What each of these people are saying, okay, where is it? We are all Miss Kendra. And this is what goes on when there is a trauma informed organization, school, congregation, any kind of organization. I don't remember. I think she's supposed to be Miss Kendra, but that's not really the way she looks in the documentary. Each one of them is saying, these are all people involved in the school and with children. And what we need in this community and others is we need everyone to be Miss Kendra to support all of our children. Prevent what we can And I think this pandemic has shown us that we can't always prevent everything, that there's a lot of trauma that is going to happen. But we need everyone to be Miss Kendra for children so that they grow up being able to manage the stress and trauma in their lives and come out of it resilient and healthy. Each of us has a unique role to play in the healing of the world, and that's what we want for our community and for Bexar County. So thank you. And at this point, we'll go on to the rest of the information and presentation. Thank you.
Hello, everyone. Thank you so much, Kathy. And the work that you and the tri-chairs have done, along with the steering committee leaders, has led us into our next phase of programming in our community and in our county as well. I'm Mary Beth Fisk, serve as the CEO and Executive Director of the Ecumenical Center, who was selected as the certifying entity to work alongside the consortia. And I'd like to share with you a bit about what our next steps were and what the next steps yet will be. And then finally, we'll hear from the Institute for Trauma-Informed Care with their slides. This is a pictorial. Really, it does describe what Dr. Fletcher mentioned to us, that there is a governance council comprised of the 3 tri-chairs. There are members from the Institute for Trauma-Informed Care. There's a member from the certifying entity and a community representative. There's a regularly scheduled meetings, even in spite of COVID. There has been efforts to connect virtually to continue to move this work forward. The consortia consisting of the steering committee and work groups, along with the Institute for Trauma-Informed Care, who is responsible primarily for the training and technical assistance, and then the certifying entity, which is the Ecumenical Center. And it's all really encompassed by quality, compliance, and evaluation. So that's this is to the credit of the consortia. They provided this document, and it did answer several questions, and I hope it does for you as well. So I'll just cover a few introductory slides. These are some of the thoughts that have been shared by the consortia as to, why would an organization want to get certified in trauma-informed care. You can implement trauma-informed care without getting the organization certified, but why? There are many reasons to become certified. Certification focuses on implementation efforts, supports change process, and maximizes successful implementation. The Ecumenical Center certifies whole organizations, not individuals. This improves client services, increases staff and client resilience and retention, as well as reducing burnout, disengagement. Increases participation and engagement, empowers the staff as well as the clients to adopt a safer and healthier behavior and practice. It also enhances other efforts such as updating policy requirements, continuous quality improvement programs, employee health and safety programs, and even helps in launching new services. And certification also indicates that your organization speaks the same language across the different sectors. These are a few responses that came from an online survey. I'll walk you through how the standards were formed and the domains were formed as well. But these are a few of the narratives responses we thought we would share with you today. One remark was from a staff person: it could trigger a negative cascade of misunderstanding, emotionally charged choices and behaviors. Why do we become certified? Why do we implement trauma-informed practices? Really to better serve and support students as they can academically be successful and lessen the effects of trauma in their life. I won't read every one of those, but I offer those to you as some of the responses that we had received. Most organizations are eager to have the knowledge of trauma, resilience, and being trauma-informed. They want to be recognized as part of the trauma-informed community. Financial incentives certainly are important, but they're not the key reason, as we learned through the survey. Other reasons include being trauma-informed helps organizations meet legislative and other requirements. Recognition is important, really the knowledge and application, with the philanthropic and dollars perhaps being the third lesser on the list. National certifications also exist, but they are very sector specific. The local community, as Kathy mentioned, wanted a certification that could work across all sectors, the judicial sector, the education, health, all speaking the same language and unifying the power of our systems. So the gathering of information became many-tiered, if you will, and that was primarily because of COVID-19. The Ecumenical Center, the Institute at UHS, and the consortium groups all worked together in helping us to ask questions and take advantage of the knowledge base that we have in our own community. We reviewed literature. We'll talk a little bit more about each of these line items, and we also have certainly learned from national experts as we've gone through the process. So how was certification designed? We didn't design the certification in a vacuum, that's for certain. It collaborated with over 160 different organizations. That number has continued to grow, and reviewed many evidence-based TIC models across the community. Really and truly, the certification will demonstrate that an organization is filled with people who understand trauma, and it will show that the organization has operationalized that knowledge into policies and procedures and everyday practices to be better at what we do for serving others. So the review of literature, again, really that broke down into several different points: published research, the implementation models, the principles by which these models were put together, and there's many similarities as we walked through that were identified. Some of them were more sector specific. There were geographic initiatives in Oregon and Baltimore and other places as well. And few of the organizations certified entities. It was helpful. It certified individuals, but not necessarily the whole organization. And we found this to be particularly important in working in a healthcare setting, mental health care setting, because we wanted to be able to apply that trauma sensitivity and application across the entire gamut, not just with the clinicians, but certainly as someone called to schedule an appointment or coming to the front desk. Part of our gathering of information, including listening sessions. There, as mentioned before, were 12 consortia work groups that we met with. We also did 2 multi-sector sessions, so anyone that wanted to come could come. The listening sessions were held from February through April, both pre and post-COVID. So obviously we met in person in February, and after February, we used a virtual environment for meeting with folks. And then the participation varied in numbers of participants and the depth and level of engagement, but all of the 12 work sectors were represented and gave their feedback. At the conclusion, as we were going through this process, we realized that given the COVID-19 environment, we needed to also provide an opportunity for people to give feedback through an online survey. So we built a survey, the management leadership sent it out to the entire consortia for feedback, and all 12 representatives from different work groups responded. There were 119 responses, and this was conducted in the month of April. Based on the survey responses, at least one person from every one of the 12 sectors replied. 10% of those responses were frontline staff, 90% of those were managers, directors, and other leadership. Everyone else, the faith-based, the philanthropy, higher education, justice, government, and other sectors participated as well. Other sector categories, 5 out of the 11, were actually housing and homeless sectors, and the Governance Council and Steering Committee are discussing whether perhaps they need to have their own work group, as specific as their work is. So the size, scope, and capacity of the sectors, all sectors had experts, as we learned when we walked through the gathering of information. They were very willing to share what they had learned, to share what they had implemented within their own organization as well. We saw both medium, small, large organizations in each sector, and cost and time commitments are definitely a major variable and may definitely impact the speed of implementation, a whole organization commitment versus an individual commitment. And then sectors have adopted trauma-informed care implementation models, and they may slightly differ, but they have a common goal. So the common themes that we discovered in going through this process over the course of the last 6 months is that an authentic implementation is what's absolutely critical. It's not a checklist, it's a journey. Long-term commitment from leaders within the organization and their board, because it's certainly something that does take time, but the benefit certainly outweighs the investment in this case. The value of a shared language across sectors is critically important and a common theme. Organizations can select an implementation model, and this has worked well, at least in our own experience, along with accessible for all organizations, and local certification adds to the national certification process, but certainly is more affordable and very culturally specific to our community. So through these conversations and this gathering of information, there were really 8 top domains that came through the online survey. They were safety, trustworthiness, collaboration, transparency, empowerment, communication, skill building, and emotional intelligence. So today, here's a snapshot of where we currently are. We have developed the definitions. Definition gives us a common shared language, and you can see in the pictures on the right-hand side the layout of what some of those terms are. That's a document that we expect to be continually being improved as new vocabulary is entered into our communication. The domains for which each of our standards fall, our certification is going to be set up on a level system, so level 1, 2, and 3. Today we have level 1 standards. We'll review a few of those standards with you on the call today. There's an online interest form for organizations that are interested in becoming certified. And I should say, it's an online interest form for becoming trained and certified. We work in tandem with University Health System and the Trauma-Informed Care Institute as individual organizations walk through the process. These top 5 certification domains for certified trauma-informed organizations were what we came to and we presented to the Governance Council and also to the steering committee and to the consortia. These were approved on July the 15th of 2020, and they do paint a very similar picture to the National Principles of Trauma-Informed Care. Local certification domains are a little different because they focus on culture, equity, and choice, which are embedded in each and every domain. Other frameworks listed choice and throughout the entire scope. So just to review, the current domains for the South Texas Trauma-Informed Care Consortia certification includes safety, physical and interpersonal, transparency and trustworthiness, respect and empowerment, collaboration and policy, skill building, and emotional intelligence. And let's remember, culture, equity, and choice are built into every single domain. So to take it down to the next level, each domain is actionable. And each domain has multiple standards within it. So let's take this first one, and it's the safety, physical, and interpersonal. And we give a description of what that particular standard is, what that health equity connection is, and then go down to the domain and offer the standard. In this case, under safety, the organization provides a safe and culturally relevant environment for all staff, clients, and other stakeholders. Examples of this would include clients and staff report feeling safe during interactions. Policy allows staff to choose holidays, have gender conversations, and many, many more things that culturally need to be included. The next example that we'd like to share with you today is on the domain of transparency and trustworthiness. As you can see above, there's a description for each, and there's a health equity connection. The standard organization welcomes critical feedback and responds in a trauma-sensitive manner. Staff, clients, and other stakeholders understand and follow appropriate boundaries, and clients understand the services provided and consent appropriately. Some examples of that would be staff and client surveys are used for quality improvements. Procedure to hear and respond to complaints is important. The patient's Bill of Rights and Responsibilities, employee handbooks and policies and orientation are up to date and complete. We have ethnicity data collected and shared. Materials may include the patient consent, a classroom rules, parent contract, and re-entry translational plan. So there's many applications that you can use under the examples while meeting the standard. The next domain, respect and empowerment. I'll give you an example of the standard from this particular domain is organization incorporates trauma-informed language in critical documents. Trauma-informed care expectations, understood by all staff. The organization communicates clearly with clients and staff and stakeholders, and the organization maximizes choice with clients, staff, and stakeholders. So some examples of this might be the strategic plan. Operationalizes the trauma-informed care domains. Onboarding of new staff is provided in a trauma-informed manner. Employee performance review includes trauma-informed focuses. Staff uses the preferred language. Treatment plan is inclusive, as well as clients and staff report feeling empowerment to make choices in the patient's Bill of Rights. Another that has multiple standards is collaboration and policy. So an example of these standards, and there are 4 on the slide today, that number 1, all appropriate personnel complete basic orientation on the domain standards and definitions. This creates that shared language across all departments and all types of jobs. So the examples, strategic plan with trauma-informed care, priorities align with the standards, domains, and definitions. It also aligns with meeting agendas and orienting to different departments. Next standard, the organization has defined policies for maximizing collaboration with key stakeholders. The staff to supervisor, the client to provider or clinician, the board to the leader. Some examples of that, staff rate supervisors as highly collaborative and complete a rate of referrals between organizations and represent policy for the board. The third standard listed on our slide focused on collaboration and policy is that the organization makes improvements based on feedback from not just the clients, but the staff and other stakeholders, and change procedures that need to be changed for trauma to be trauma informed. The way in which we can measure this is feedback and listening to what we're being given, whether it's verbal or written responses, or in some cases, even nonverbal responses. So quality improvement team members individually, TIC certified, can also be an example of that. It's embracing the concept and embracing the change. The fourth item listed as a standard on the slide is that the organization understands the sector's policies that facilitate and inhabit the organization's TIC implementation. Here, what we could look for is agendas showing participation in meetings with related TIC topics, work group reviews, state requirements in the classroom being met. Another of our domains is the skill building and emotional intelligence. This is the final of our standards and domains currently adopted. The standard may say, says that the organization prioritizes learning and emotional intelligence of staff, clients, and stakeholders. The organization values the individual's strengths. The staff understands their work is trauma informed. The staff engages in organizational support and staff resilience opportunities. An example could be our HR policies as it relates to TIC related training and onboarding and retraining required on a schedule. Performance review includes TIC skills, building on strengths. Managers are trained in coaching on emotional intelligence. We have an employee assistance program. That's an important thing, along with other services that best support your type of business. In our case, it may be a guided meditation. It may be contemplative prayer, wellness walks, and support groups. Those are just some examples to offer. So the timeline. Well, the vision of the South Texas Trauma-Informed Care Consortium is a certified trauma-informed Bexar County and San Antonio. This requires an organization to provide training and technical assistance, which is available nationally, but is prohibitively expensive for many organizations and requires an entity to do the certifications, but most importantly, it's not as culturally sensitive and not as culturally applicable as perhaps the local entities, both training and certification practices. So again, the Institute for Trauma-Informed Care at UHS was created to provide the training and technical assistance, whereas the Ecumenical Center was selected to be the certifying entity for trauma-informed organizations to build the standards, the domains, to draw consensus around language, as well as rolling out the ongoing recertification process. So by collaborative design, the consortium then really has done a great deal of work, and we're so grateful to be a part of this very important move for our city that will certainly add credibility to San Antonio, to Bexar County, and certainly under the auspices of our leadership. Dr. Vincent Folletti and many other notable experts in these fields have visited San Antonio and have also lent their expertise as we have designed the plane as we're flying it, as Kathy said. The pilot testing of certification and training resources will begin with 3 organizations. We've already launched that. That began this month of August and will carry on through the fall with those pilot studies. The way to get involved, if your organization is interested in becoming certified and trained, is to submit online. There's a link on your slide at www.ecrh.org/trauma-informed-organizations. What you'll see is a trauma-informed organization interest form. What this allows is for both the Ecumenical Center and the Institute at UHS to know your interest in participating in both the training and certification process. And it gives us an idea of how many employees you have so we can best prepare resources for the coming year once we complete the pilot studies. So next steps. Currently, we're collaborating with the Institute to develop a crosswalk between the standards, domains, and training and technical assistance. We are in the process of conducting our pilot certification process and training process. And the Ecumenical Center, specifically the organization for which I represent, is also pursuing our own national certification. It is a very costly venture, but important in serving in this role as the certifying entity, that we ourselves have also been put through the rigor that is required of a certified body and a culture change for which we know this is. This is a template, an organizational summary that may be of help as organizations are going through. These are the types of informational items that will be offered when someone has an interest in walking through the process. And we will be sharing these types of documents along with the standards and domains and examples and so forth as individuals expressed interest in becoming certified. So the certification steps, we already talked about this. Submit your interest form. The orientation will introduce the internal work group to the certification process and the trauma-informed care journey. Then there'll be a self-assessment opportunity and an opportunity to set priorities for change. One of the critical elements, as we mentioned before, is that leadership has a buy-in from the very beginning, that they're committed to the success of this program and the successful change that it'll bring about. So change in documentation, implementation of the TIC model, which is, again, trainings, technical assistance, improvements, and maintaining documentation is critically important. Then there's an application for certification, which includes documents to be reviewed. So there's a desk review and then scheduled site visit and then a recertification process that just ensures that we all have an opportunity to use this not as a checklist, but make sure that we're on that journey to continuing quality improvement and trauma-informed care. So the desk review might look something like this. There's multiple different documentation types that can be submitted. We will certainly not have, again, a checklist that you have to do all of these, but what demonstrates that you have indeed provided and your organization has made the switch to this trauma-informed care mindset and prevalence in your organization will be what we're looking to support. The site visit is simply a sample. It's an opportunity to confirm those policies and procedures in practice. It's an opportunity to observe indoor, outdoor spaces, observe staff and their behaviors and the clients as well. Random samples of documentation, interaction with staff, volunteers, board, and clients. Interviews and even potentially presentations might be helpful in confirming compliance. So preparing for certification, recommendations for a trauma-informed journey is that leadership commitment. It's also communication, change management, creating an implementation model that works for your organization and your type of organization. Change model, the structure for which change will be selected or several under construction. There's several different ways it can be approached, and there's not a wrong way, but there certainly are ways that show evidence that you're working in that right direction. Organizational review of policies and procedures, even everyday practices, is important. Using the standards as a guide, and then document. So there are many examples of traumatic events, and Dr. Fletcher led us off with talking about the acute childhood experiences and what some of those look like for our young people. But we know trauma can happen in different times during their life as well. Here's a list of a few traumatic events: domestic violence, dating violence, violence in schools or in churches, shootings, muggings, burglaries, bullying is unfortunately part of our world today, and we're working to continue to educate and to be very sensitive to that in so many ways. Sexual and physical abuse, natural disasters, hurricanes and floods. We've seen devastation in all of those areas, and fire and earthquake as well. A serious car accident, unexpected or violent death of someone close to you, like a suicide or an accident, serious injury, burns, a dog attack. These are some that were offered in the literature. A major surgery, even, or life-threatening illness, war, combat. Those are things that we think of all the time. But do we think of COVID-19 as a traumatic event? We should, because it's certainly a trauma. It's a change in our everyday life, and it's something that we should be very mindful of. So there are some tips to staying resilient amidst COVID-19. Some that we could probably all echo, and that is limit your social media and your intake of other media. Limit that exposure for not only yourself, but also your children and your other family members. That's just a healthy way to take it all in, is find that right boundary. If information is needed, seek out a reliable and trustworthy source and focus on what you can control. Not so much what we don't have control over, but what can we control? Prioritize self-care, find ways to remain connected, brainstorm and set activity goals. Most recently, the Ecumenical Center held our Camp Wellness virtually this year for the very first time. And these are working with kids 5 to 12 years old of age. One of the things and the activities that they participated in was creating a gratitude box. And that gratitude box, you had slips of paper, and instead of focusing on all the things you couldn't do, it was talking about things that you're grateful for. So it seems pretty simple, but even as adults, I think sometimes we can use that reinforcement as well. On a day that we don't feel so grateful, go back to that box, read what we wrote before, because there are many blessings in spite of the difficulties that we have today. Before we move on, I'd like to, though, ask everyone to take just a moment of silence and lifting up those families and those who have lost loved ones to COVID-19 and other illnesses during this time. Thank you. We are very grateful to our healthcare workers, to all who have made such a difference and continue to in serving our communities at large. So back to our trauma-informed care conversation and really looking at, as Kathy mentioned, the leadership, this consortia, the governance council, the steering committees, and then the training institute, which is University Health System, and the certifying entity, the Ecumenical Center. We found it helpful for ourselves to really identify, what were the tasks at hand for both entities at our level. The Trauma Informed Care Institute will certainly accept applications for training and technical assistance. There'll be training organizations and individuals preparing for trauma informed care certification and providing required and optional trainings, training the trainers, and technical assistance for TIC. Whereas the charge from the consortia and the governance council to the certifying body was to really develop the standards and the domains and the definitions, not in isolation, but in collaboration with everyone, including that big graph you saw early on, and each and every one of the consortium members and areas of expertise, both nationally as well as locally. You can see the outline of the two organizations and what our responsibilities are. And it's very important, those arrows right there, because we truly do believe that working together is the way in which we can make this plane fly and continue to fly and do well as we move forward into our community and beyond our pilot sites. I'd like to take just a little bit of time during our talk together today to share with you the Ecumenical Center's journey at becoming certified in trauma-informed care. We've engaged with a national organization, and I think you've heard earlier some of the reasons why that's helpful, but some of the challenges it brings from a cost perspective, a geographic perspective, and so forth. But we thought it might be helpful to share with you kind of what we've learned along the way. And as we look to completing our national certification, We're currently in phase 4. We only have one more phase to go, so we're grateful for that, and we know that it doesn't stop. It just continues. So our journey began with orientation and training. More than 315 hours of staff training. 100% of our staff have been trained. We share a language, a communication. We share goals and expectations. We've developed in the very beginning, which was very important, a TIC work group, and that was organizational wide. So we had representatives from the front desk, the billing office, the finance office, certainly our clinical mental health providers, as well as each and every other group that works within the ecumenical center. So it was admin and clinical. All staff were invited to provide feedback throughout the brainstorming phase. The TIC work group reviewed all staff feedback. We didn't, for sake of not of wanting to get the honest feedback, we didn't bar anything. Just tell us what you think. Basically, leadership has led the prioritization process once each of these items were presented, and the Ecumenical Center's policy on trauma-informed care ensured regular reviews to keep us focused on the quality improvement measures. So the results for us today is we've certainly seen improved communication. We especially have seen this with our remote staff. We have 25 locations in South Texas, so we're geographically removed from one another, from San Antonio to Corpus, Laredo to McAllen. So many organizations alike that have other offices, this has certainly been a benefit to us. And as a place of healing, we've been providing trauma-specific services and taking trauma approaches for a very long time. But pursuing the national certification has given us the opportunity to do some reflection, redouble our efforts to make sure we're approaching everything in a trauma-informed way, from answering the phone to our most critical client that we serve. So just a few of the areas and how we may have addressed them. It's certainly not a complete list, but it's just a bit of an idea. From the emotional safety perspective, we're using and contracting with Community Connections as our implementation model, which matches very closely what the San Antonio and Bexar County area has implemented. They're providing our national credential. You'll see both at the local and certification domains represented. So we are fortunate enough to have art in our building. So we have a committee that has been working to make sure that we have a very healing environment as folks come here who are hurting and need assistance, and that our clients have an option for where they receive their counseling services, whether it's in the counselor's office or it's in our garden area that's open-ended and a beautiful area with plants and butterflies and nature, or whether it's virtual in a telecounseling sort of way. Our physical safety, here's a few of the things we identified in the very beginning. We had a light bulb out in the parking lot. Well, when it was evening time and clients were coming in and our staff were leaving, that caused for some concern. So as simple as a light bulb, you may identify things that you just don't always put to the priority list. And that was a very clear thing to do. But there were some that certainly were more subtle. The clear procedures for evening and after hours weekends, the way we greeted a client when they walked through the door. Did we talk with them at the front desk about the fact that they had a past due balance? We changed that process. We changed it intentionally so that we would not embarrass anyone and that we could have that private conversation in another office. So transparency and trustworthiness. These are just a few things that we did. We only took some very quick examples to share with you today, but updating the website calendar and clarifying procedures for intake and scheduling changes was amidst a few of the things that were kind of low-hanging fruit in this process. Respect and choice, part of maximizing the client's choice was making sure that all of our staff understood what those choices were that we could offer. So we provided additional training to our front desk staff and the scheduling staff. We also created a special team to work and support of our front desk and scheduling staff. So when a client needs a little extra support to understand the choices, there was a second person to transfer the call to that was familiar with all of those things and that can give the special attention and time needed to that individual caller. Collaboration, very important. Conducting standardized client feedback surveys to get to know their thoughts, to understand what their needs are, and to see if we're actually meeting all of those needs. New concepts emerged from the counselor-client relationships and recommendations. A group that has been longstanding now for over a year is the Women Veterans Poetry Group. And it's a closed group because they have some like concerns. Another program for which has been underway for several months now is providing healthcare and hospital, the debriefing and different types of mental health supports through this COVID pandemic. Wellness conversations became a big part of what we did in the beginning of COVID. It was an opportunity. It was a program for which we opened up via phone an opportunity to speak with a counselor for 20 to 30 minutes at no cost. If someone was feeling fearful, wherever they were from, whoever they were, they had an opportunity to speak with a licensed professional counselor to try to put it in perspective. And if they needed additional help, certainly individual therapy was available to them. Teaching new skills to clients is an empowering tool for their well-being. It's also important in supporting our own staff, and keeping our self-care skills sharp is important during this difficult time and always, because these are tools for all the ups and downs that we certainly experience in life. So this is a slide that I've borrowed from Roger Fallett in Maxine Harris's presentation back in 2001. But I think it's a great illustration that talks about the road to trauma-informed care, and that trauma-informed care calls for a change in organizational culture, where the emphasis is placed on understanding, respecting, and appropriately responding to the effects of trauma at all levels. Basically, you can kind of see that roadmap, and as you dive into trauma-informed care, you realize that it truly is a mindset versus something that is technologically or even operationally impossible to achieve. This slide depicts what and why we do all these things. Our community is number one. We need to be connected, healthy, and resilient. We need to work towards restoring lives, and many in healthcare, mental health support care, and those in our faith communities, as well as many others. That's what we do. We work towards offering effective supports that are accessible. And then foundationally, making sure that we have a shared knowledge and understanding of trauma-informed values and actions and systems. And then disrupting the cycle. Yes, let's disrupt the cycle of child abuse and child exposure to trauma. Let's provide an early intervention there so that fewer concerns may follow that child forward, as was depicted in the video that Kathy shared this morning. And then, of course, strengthening resilience. Resilience is a very important word in this whole process. Enhance the protective factors to help people bounce back and reduce the risk for poor outcomes. Each of us have a unique part to play in the healing of the world. When each of us is trauma informed as an individual, and then our organizations and our systems can function differently. When people walk into our buildings, meet our staff, use our services, they can sense the difference in every single interaction. And I want you to meet one of our favorite kiddos, who is a friend of the center, and on that particular day this picture was taken, he was visiting with our resident companion dog, Sadie. So that concludes the segment on the trauma-informed care certification piece. And I'd like to transition now into a review from the Institute of Trauma Informed Care. Due to a scheduling conflict, the organization, Belinda was not able to be with us today, but she is doing a fantastic job, and her team, in bringing the Institute together for trauma-informed care and providing for a healthy training system and technical feedback. So Belinda, thank you for offering your slides, and I will try my best to review what you have shared with the group today. And if there are any questions, I know that Belinda will be available subsequent to our conversation today. So the Institute has, as was mentioned before, institutional partners. And the development of the Institute was a partnership between University Health System and the City of San Antonio and Metro Health. As Dr. Fletcher talked about in the very beginning of our talk together, this is where it began to take some shape and some form. There was a strategic plan that was put together, and that strategic framework and action plan is what really, before the partnership, allowed for the South Texas Trauma Informed Consortium to come together to create an institute and a certifying process that would best serve our community. So the Institute for Trauma Informed Care, their vision is to transform San Antonio, Bexar County into a trauma-informed community, create innovative methods to deliver training and technical support, and establish a sustainable practice in the community and expand the vision beyond San Antonio and Bexar County. The three objectives that are noted for us today on the slide are: number one, to provide community awareness and education; number two, to train using evidence-based programs; and to assist organizational readiness. We mentioned before that level 1 standards are now available, and level 1 training plan is certainly available and ready to go now at this time as well. So the components being provided for that training from the Institute include the Adverse Childhood Experiences Interface curricula, the ACEs, if you will. And that is a wonderful training program that really foundationally lays the groundwork for where we go with trauma-informed care and the reasons for it. Also, the Institute's another component of their training plan is Community Resilience Initiative curriculum, as well as sector-specific trainings they will have as needed. So the ACE interface curriculum basically is a proven educational framework and strategy for disseminating information about the ACEs study, along with neurobiology that explains why ACEs affect people's lives and what can be done to dramatically improve the health and resilience for this and future generations as well. The Community Resilience Initiative, or CRI, the Institute has gone through the courses 1 and 2, and that curriculum will be made available. The course 1 focuses on the KISS framework. That's knowledge, insight, strategies, and structure, and discusses the research literature in the fields of neuroscience, epigenetics, ACE studies, and resilience, and identifies and utilizes the science of how brain networks as a strategy for addressing behavior work. Each of these, that's course number 1. Course number 2 focuses on the 6 pillars of practicing trauma supportive approaches by using celebration, affirmation, regulation, expectation, education, and restoration. So certainly that these are not the only courses available, but there will be also sector specific as needed. The Institute will secure training as needed for each of the 12 sectors listed below. We heard about these in the very beginning of our session this afternoon, but they do include education, K through 12, child care, child welfare and foster care, mental and behavioral health, medical, hospitals, clinics, the justice systems, local government and strategic communications, philanthropy, youth development and after-school programs, faith-based congregations, family support services, and higher education as we know it today. One of our concluding slides from the Institute includes what is coming next, and that's basically expected to go live September 2020 is the website and training application from University Health System for the Institute for Trauma-Informed Care. This website will include a great deal of research information. They will have compile resources that can be additionally added. There'll be a tab for training and certification. So, and each of the communication systems, this website that is a part of the UHS will also communicate to the certifying body at the Ecumenical Center. So we're very grateful. We know that developing a website and web pages that are interconnected certainly is no small task. So we're looking forward to September and being able to access this resource as part of our South Texas Trauma-Informed Consortium work. And how to contact the Institute. You'll find on the slide in front of us that there are several individuals you can contact for more information. The presentation today was offered by Glenda Garcia Rattenberry, the director of the Trauma-Informed Care Institute. You'll find that her email address is there along with her office phone number, and I know that she would be more than happy to answer any questions that you might have, as well as Dr. Villarreal and Dr. Micah. So at this point, this concludes our conversation as far as our presentation for Trauma-Informed Care, which includes the work of the Trauma-Informed Care Consortium, the Governance Council, the Steering Committee, the Institute, who's providing the technical assistance and training, and the certification process. If you have an interest or have any additional questions beyond today, please feel free to contact me and I can either offer a suggested response or get you to the right person who could offer that response. So at this time, Madam Moderator, we can entertain any questions or comments.
Okay, I'm back again. And Mary Beth, if I can ask you if you would close your PowerPoint on your computer, because that takes a lot of computer brain and sometimes interferes with other things. So that was a terrific presentation. I'm sorry, I should have said that first, but I'm always trying to prevent technical problems. So it was wonderful. I learned so much. And I want to tell folks who are here for their CEUs, I'm going to put up the second CEU link now. And hold on for 2 seconds. And the sign out code for this session is 63. Hold on, putting it in there. And to get your CEOs, there we go. Okay, I think I did that correctly. Copy paste is our friend. Okie doke, now we're ready for questions, and we have a bunch of questions. And people actually have upvoted the questions. Go guys, thank you. So they pushed this question to the top. They asked if this training actually counts as official trauma-informed care certificate as well as CEUs.
I would just offer that the CEUs would be part of the Pathways Conference. There are many different ways in which we can gain training. There are several online trainings. The trainings, of course, that will be offered by the Institute, the Trauma-Informed Care Institute at UHS. maybe the official trainings that are needed for certain levels of certification. But I think we would all encourage just to take advantage of every opportunity. Kathy?
Yeah, I would agree with that. There are a number of things going on right now. For my organization and my sector committee, we have transitioned from, not always comfortably, but it's working well. We've transitioned from in-person training of early childhood teachers and childcare providers and teachers, and our next event is on September 12th, and it will be on trauma-informed care and available on Eventbrite and on our website. So there will be 4 presentations on various aspects of trauma-informed care.
So lots
There
of
are
ways to
there are a
learn.
lot around the community,
Mhm.
and right now there are a lot nationally, remotely.
Okay. 2 people wanted to know about this as a CEU, since to a certain degree they weren't learning about trauma-informed care, but only how the training came to be, sort of, so not with great respect to this presentation, but it's really learning about the training right now, sort of, right?
Most of our presentations today was focused on
Yeah.
the development of the program here. I think Kathy offered those some of the really important facts about trauma-informed care in its introduction in the beginning.
But our purpose was really to describe the process, how we went about beginning this community endeavor, and where we are, as opposed to specific training and specific strategies.
Mary Beth, I muted you. You're okay. You're free to cough. Okay. Okay. I'm going to unmute you. And the next question is, I understand that this was mainly to have an organization certified, but is there information? I think this question may have come in sooner than you gave all the answers to that, but it was having an organization certified versus individual training and certification. And this person lives in Bexar County, but works in Medina County. So.
Mm-hmm. There are many opportunities to become individually certified by different types of training. As Kathy mentioned, there are many that are readily available on the internet. You might also want to check with the Institute and see what they might recommend as well for individual certification.
Kathy, do you want to add to that?
One of our visions is the Institute will be a training facility that will offer the 3 levels of certification we're talking about, but will also be a go-to place for individual training. I don't know how the individual process of certification works around the country or would work. I do know we expect to be a hub for training. Is that about accurate, Mary Beth?
I believe so.
Okay.
Okay, and then another question that got from Mia Morris that also got an upvote from somebody else: can churches become certified?
Absolutely.
Absolutely. Exclamation points.
We have one of the sector committees is faith-based and congregations, and that is just a very, very important sector of the community. And yes, they certainly can.
And please encourage those from all sectors, but certainly from the faith sector.
Mm-hmm.
Please contact us. We'd love to hear from you.
Yeah.
Are there some examples of churches elsewhere?
I know that there are, of being certified, I know that a lot of training is provided to churches, and it depends on the individual congregation. I don't know about certification. I would imagine that any of the national organizations that provide, for instance, Community Connects, that certifies organizations, probably in their history have certified churches and other congregations.
It certainly may be a sector that hasn't necessarily moved in this direction as quickly, and we would applaud you for doing so.
Right.
And we think that, you know, really providing a holistic approach to trauma-informed care in our community absolutely involves spirituality and our faith community.
Let me give you just a little example. And this was, a number of months ago with a group of um, folks representing congregations. One very large congregation and quite affluent congregation in this community were shocked when they saw the film Resilience and realized this is what now we understand. They had done a survey at some point of their congregation just to find out more about mental health needs, and they were very shocked to find out how much, what serious issues that their congregation, which is quite largely professional, were dealing with. A great deal of depression, suicide, alcoholism, domestic violence. So they did a little more looking at it and found out, and which is what has come out consistently with the research, an incredible level of early childhood trauma. And so when they saw the film, the documentary Resilience, all of a sudden it's like, this is exactly what we're seeing. So, you know, folks go to their congregations. And so for those groups to be well aware of the impact of trauma is incredibly important.
Okay, thank you. Can and this came in, I think, perhaps early as well, but it did get an upvote, so I'm going to let you repeat the information. Can individuals be certified in trauma-informed care? Oh, sorry. Wait a minute.
No worries.
There we go. Okay.
Absolutely. There are many opportunities for individual certification, and currently, I think many of us that are working with this effort in Bexar County, we hold individual certifications with different types of training providers that take it from a different angle. And so I would say that, as Kathy mentioned earlier, that there will be an opportunity to do that also through the training at the Institute at some point in time, but we will certainly pass that question on to them as well so that they can make available the information about the timeline for that.
Okay, and then the question right after that is, and I should have combined them, where can individuals become certified in trauma-informed care?
What we will do as a follow-up, perhaps Kathy, we can agree to do as a follow-up information about that. So since there's so many inquiries about that, I think that definitely that is on the schedule, and how quickly we can respond to that. I think we can get that information out to everyone soon.
Well, we have a schedule, we have a timeline, but then COVID hit. So, you know, things are a little screwy right now. It's moving along, but you know, it's not quite what any of us anticipated right now.
But the answer is it's coming, and we'll keep you posted. Okay. Okay. Mary Beth, you're muted again. Let me unmute you. Okay, what is the incentive for an organization to go through this intense process? And it sounds really intense.
It's intense, but it's really changing the culture inside the organization so that you become more sensitive and respectful of both your internal and external clients. I would say, as we learned in the survey, and then certainly Kathy can add into this, but on the survey we heard that the motivation that most people were interested in was recognition, being able to have available credentialing that said, yes, we stood up, we not only incorporated trauma-informed principles into our business or our service offering, but we've also been certified by an outside entity that has ensured that we are living up to those practices. And that recognition for that for their clients, the service to the clients to be able to be at the best that they can be at providing whatever their service is to the individuals has been the greatest motivation that we've seen noted to date. Financial being the third, and that may relate to be a nonprofit and incentives and that sort of thing, but certainly not the primary motivation, which is very important. It should be a very authentic decision.
One of the things that has come out over the past several years is that organizations, services that operate in schools that operate with a trauma-informed lens, the outcomes are better. The outcomes are better for kids. The outcomes are better for patients. And that's probably the biggest motivating factor, I think, for most of the folks that we have contact with, and for the community.
Okay. And this is I want to point out, by the way, that there are a lot of resources being added in the chat by some folks who have additional information to add. And also in the chat, there's the post-conference survey, which we really encourage everyone to fill out. That's about the entire conference, and it's that kind of feedback that helps make next year's conference better. And someone asked a question earlier about the film that was mentioned, and that film Resilience. A link to that is in there now. Thank you, Susan. Susan,
It will give you, I believe, a trailer. It's not available, for instance, on YouTube or Netflix or anything like that. It goes to nonprofit and educational organizations if you want to purchase it or purchase the rights to it. So it's not something you can go to Netflix and find.
Okay.
Yeah.
Okie doke. Let's see. I wonder, Jessica, you did answer this other question about CEUs. Okay. And the question is CASA involved and is NAMI involved? And,
yes.
Yes. Okay.
The NAMI CEO is very involved, has been from the beginning, and she is a co-chair of the Mental and Behavioral Health Sector Committee. CASA was one of the co-chairs. The CEO of CASA was one of the co-chairs of Family. Is it Family Support or Child Welfare and Foster Care? No, yeah, but she has just taken another position and has moved on. So we're replacing her. But yes, they're both involved, and then they're both involved in the full consortium. Those organizations and their staff are both involved in the full consortium.
Okay. And another question, the documentary, and that Susan has answered that in both this Q&A area and in the chat area of the documentary. And then this interesting question from before, earlier, as a BOCES, B-O-C-E-S school nurse, this would be great for the BOCES school nurses as well as the Nassau County school nurses. How can we get this to those organizations?
Absolutely. If they can pick up our contact information, we'd be happy to send them additional information about the work being done here in Bexar County and San Antonio.
But particularly now for school nurses too, right?
Yep, absolutely.
Post-COVID, I mean, school nurses, school teachers, school staff.
Absolutely.
Yeah, definitely. Definitely. I was intrigued also, I've run out of questions, so guys, come on, ask some more questions, but I wanted to pose one of my own. I was intrigued to see all the areas of the community that you're looking at training going forward? I mean, all the different, I mean, it's all over the place, the whole city. The whole city could be affected by this, right?
And that's the whole idea.
Ideally.
I hope so.
That
Right.
was really what our tri-chairs in the very beginning, as they grouped and came together. That's been their vision, and that vision now is shared by so many 600 plus people, right, Kathy?
Right.
Because San Antonio and Bexar County can certainly find a unique place in our country by
Mhm.
being that trauma-informed community.
Mhm.
Most other efforts are, I think, Mary Beth said, are sector specific. We know of one that's juvenile justice specific. There are others. Um, there's also a debate, not, I think it's much less right now, about whether, for instance, in a healthcare setting or anywhere, that all people should be screened using a scoring sheet, essentially, for adverse childhood experiences, because we know when you hit a certain level that some conditions go up exponentially. We opted not to do that. We're on the side that says no, you develop trauma informed practices throughout your community. Because one of the real issues, I mean, it's an issue here in our community and in our state, and actually probably everywhere. Um, ethically, if you have a patient, a client who scores very high, you know they've experienced a lot of trauma, what do you do then? Are the resources there? Are the mental health resources there? Are the supportive services there? And we really do not think that you can do that without knowing for sure that all of those are in place, and they're not. There just simply isn't enough. So our approach is really to spread trauma-informed practices everywhere. That's our side of the debate.
And I think just echoing that anyone who's familiar or comes from healthcare understands the term universal precautions, and
Mhm.
that's exactly
That's exactly
how
what it is.
Dr.
Mhm.
Bridger also and Dr.
Mhm.
Fletcher
Right.
have described it as, we're treating everyone as though they've experienced trauma, so no one is isolated or
Right.
can they can't be compromised from a HIPAA perspective on their confidentiality because they
Mhm.
have been or are a trauma survivor.
Mhm.
Well, and I think that's what COVID has taught us, right?
Right.
That that it's universal.
Right.
I mean,
I
this
think
is
that's very important too, because we, many of us who've worked with families and kids, for instance, think of trauma and adverse experiences as the kinds of things that go on in the home: child abuse, domestic violence, death of a parent. And we sometimes forget that there are natural disasters that we can't control. For instance, with hurricanes, children lost, and with COVID, they've lost family members. They've lost, I mean, literally lost, died family members. They've had their whole worlds turned upside down. They've lost their regular school and school friends. And there's so much that went on. And for many families, what happens in a disaster like that, and what's happening here, is the actual natural disaster, if you want to call it that, or pandemic, public health disaster, is compounded by other things. It caused, for instance, unemployment, tremendous amount of stress in a tremendous number of families, food insecurity, evictions from their home. I mean, so these things just continually pile up. And we have to be aware that virtually all kids are going to come out of this with at least some exposure to trauma. Um,
it's making it very universal. There is a question in the chat, by the way, that says it asked whether the institute means university health systems when you
That
reference
yes,
the institute. Okay,
that was who was selected in
right.
partnership with the city of San Antonio, and they serve as the institute, and the responsibilities of the institute are primarily the training and
Mhm.
technical assistance. As a certified body that I represent,
Mhm.
we work in tandem together. They would have been on the call today, but unfortunately had a scheduling conflict.
Another question, procedural question. When an organization does get trained, is there assistance to help the organization to review policies and procedures, or is the organization left to their own devices? That sounds traumatic in itself to review.
It does. No, it's actually a partnership that we entered into. So the whole idea is to help an organization move into this new culture of being trauma informed and offering trauma informed sensitivities and awareness and culture and policies and procedures. So that's why we're here.
Mhm. Okay. And um, another person asks, I'm my own company, community health worker, and registered yoga teacher and certified in trauma-informed care for youth and adolescents. Am I eligible to be individually certified without working for someone else?
I would I
Yeah.
would say please call us. Absolutely. Absolutely. You're working with people, you're making a difference in people's lives, and embracing these principles is more complicated the larger you are, certainly. But we have some very large organizations
Mhm.
pursuing certification. So I'd say please get involved, give us a call, and we'd be happy to share information with you.
I want to point out for people who are in the chat listening to this live, one of the joys of this particular software that we're using is that if you have a question in the Q&A, I can click on a button where they start answering, and that's what I'm doing. And so when you come back to replay this video, you just have to click on the question and it jumps straight to that spot in the video where they answer the question, which I consider to be pure magic. So
That's great.
it's when technology is our friend. Uh, in the under the universal, you're taking this to a universal as opposed to sector specific. I'm reminded also that while COVID is totally universal for the whole globe, even incidents like school shootings, I recall when I was teaching at the university in one state, a school shooting at a university on the other coast dramatically affected the kids at the university where I was teaching, an entire country away. So, I mean, it's not even those big events like that are not really totally local, right?
Not with all of the electronic media and social media, all that sort of stuff. No. And kids hear and know a whole lot more than we ever think they do.
Absolutely.
Absolutely. And last year we heard during one of our plenary sessions from the pastor of the Sutherland Springs First Baptist Church about the shooting that occurred locally, not far from most of us. And that impacted other churches. It certainly impacted, I can say myself, in going to my church the next time. You come across from a bit different perspective in schools, of course. So, and there is re-traumatization. So when you have experienced a trauma of some sort, not only vicarious trauma from learning about someone else's challenge, but there is re-victimization that can occur. So that's why trauma-informed care principles universally applied are so important in all settings.
Absolutely, absolutely, and I'm thinking also about first responders who were not, who are not at the scene. And in my profession as a journalist, we do not consider ourselves and should consider ourselves to be first responders in many instances. So it's another reason for that.
Absolutely.
Another reason for that. Are there other cities that have taken this broad an approach, or other folks who tried to do this, or is it San Antonio out there blazing this trail, the universal approach to it?
Well, I think some of them are moving towards that. And the one I think the most is, oh goodness, Nadine Burke Harris's place. Dr. Nadine Burke Harris is a pediatrician who is one of the leaders in this whole movement. She is a pediatrician, healthcare provider. And initially, the Institute for Youth Wellness that she formed was very specific to healthcare in a specific neighborhood and screened everyone. They are now doing a pilot, and I believe that's what the speaker, the current CEO, said when she was speaking to us recently, Mary Beth. But they're doing a pilot in another community in California. They're in San Francisco. And it sounds very much like a much more universal approach because they are looking at all the different sectors of the community. But
I
that's a
think
very,
that
keep in mind, that's small compared to the size of San Antonio.
and the diversity, and especially for those who have been asking the questions on the call today from our faith perspective and getting our faith leadership behind
Mhm.
and embracing this. It's very appropriate. It's very, very connected. And as the judicial system and as our faith leadership become more and more engaged in this effort of trauma informed care and becoming a trauma informed care city. I think that San Antonio and Bexar County have a very unique opportunity to be one of the thought leaders in experience in doing these kinds of things under the leadership that we have.
One of the first areas that I heard about it was trauma informed care training for people who are helping asylum seekers coming into San Antonio through with the Interfaith Welcome Coalition and the children who had been brought here from Honduras, Guatemala, and how important it was to help that transition for families and children and really be informed before giving someone a hug. I mean, right? It's that basic.
Which is so hard for many
Right.
of us that's an expression of love and caring is to give you a hug, and we just safely cannot do that right now. We need to continue to wear our masks and keep our social distance, and there will be a time when we hope that will be another option for us, but we're just finding different expressions of how we can say to someone we care about you. It can be tone of voice. It can be so many different things, and I think that's kind of at the base principles of trauma informed care
Mhm.
is to find those
In
ways.
terms of choice, also, uh, while most of us feel very good about expressing our caring by giving a hug, for the person receiving it, there are a lot of folks for whom that is a trigger. Um, so part of understanding trauma-informed care, trauma-informed practices, is understanding that people come at this differently based on their history of trauma. Um, and a hug may be the wrong thing for someone. It may trigger a lot of very bad, frightening memories. So that's part of the training. Understand the trauma, understand where that person is coming from. And one of the hallmarks of the whole movement is we stop asking things like, what's wrong with you, but get to what has happened to you.
Mhm. Thank you. That's a very, very, very relatable thing for all of us to get a fundamental understanding of how we're changing the way we communicate with people and our sensitivity to where they've been. Do you we're almost at the end of this time period, and so I wanted to make sure that if you had some things that you wanted to circle back on, that I give you an opportunity to do that. Kathy, Mary Beth.
Oh, goodness. If anyone is interested in trauma-informed care training, particularly aimed at early childhood and childcare, there will be something on our website, voicessa.org. It will also be on Eventbrite. I would urge you to look, though, at all your different sector partners or what's going on around the country. There's a tremendous amount right now that you can access. And as someone who has zero, and Charlotte Ann certainly knows this, zero comfort with the technology, I am extremely impressed with how information can get out to people, how many people can be impacted, how many people we can reach. So take a look at anything you're interested in somewhere on the internet, and somewhere on Eventbrite you will find some training that will fit your needs right now.
And Charlotte and I would just add that we are excited about the opportunity. We know that with COVID, of course, it hasn't been exactly how we expected it to roll out. But we know that it's important to look at ways in which we can adapt. And by adapting through the media opportunities like you've provided through the conference with Pathways the last 2 days, that's important. And the same is true for trauma-informed care certification. There are still there are ways to train, and there's ways to certify and prepare, even in spite of having closures and not being able to meet in person. So, we just encourage you, if you're interested, please let us know. Please contact us, and we will get you in the loop of the consortia, and that way you can see what work has been done and see if you find your place in that work.
There is definitely information out there that is trustworthy information on the internet, and that can be very, very helpful. I mean, there is some very, very good stuff out there, and you've provided some good links.
One of the areas that we really need to consider, and this impacts, I think, most of us in one way or another, whether it's in our own families or our professions, children and teachers are going to be having, we know from a previous training we did a month and a half ago, teachers, school nurses, folks who work with children returning to school and childcare are really worried, are really scared about the health issues, but also about the trauma and the scary experiences that children are bringing back to school with them. So if you're one of those people and you have kids coming back into the school situation, look around the internet. Some of the early childhood and early education organizations are offering some information and training virtually, because it looks like there's a lot of anxiety around those issues right now.
And I see that Susan Smiley has put the Voices for Children website on there, and we will get that September 12th training that you mentioned on there shortly, so that people know. But keep an eye out for that Voices and events there for more. There's also some past events that could be really, really useful. Right, the Sun Kisses, Moon Hugs.
Yeah, the social emotional learning, which is on YouTube.
Right, and the Rhino Who Swallowed a Storm.
Rhino Who Swallowed a Storm by LeVar Burton. LeVar Burton from Reading Rainbow and Roots, and what's the other one? Star Wars, Star Trek. Bless his heart. Is reading his children's book, I Understand, free on his website right now. In my opinion, that is the best children's book on trauma and loss and healing that I've seen. But he's reading it free on his website, I'm told. And this is kind of kudos to our sector work group in early care and education. The training we did with the folks who wrote another wonderful book on staying connected and healing, Sun Kisses, Moon Hugs. They are in California. They were chosen to come here to do some training by our group, which they now can't do, but instead they did it virtually. So we were able to do this with them in California and looking at bibliotherapy and art therapy to help children who'd been through, and adults who'd been through, some scary things.
And it's wonderful, and you can replay it, and it's on YouTube, and it's, I believe, on the Voices site, so people can take advantage of that. Thank you. This has been very rewarding for me personally, and it sounds like it in the chat that people have learned a lot and really were inspired by the presentations from today. Don't forget, folks, to fill out the evaluation in the conference evaluation, and that's in the chat box and will be really helpful. And I hope you guys are ready. Oh, they renamed the book mentioned. Sun Kisses, Moon Hugs, or there it is. Susan, thank you. Susan's got it in the chat.
And it's also in Spanish.
Okay. Yes, the Spanish version out too.
Yeah.
Thank you very much. And I hope you guys will join us next year.
Thank you. Thank you all for coming.
Okay.
Thank you.
Bye.
Bye-bye.